I just realized you should put Rosette's cookies out.
Oh,
They're
they're
sitting
over
over
here.
there in the Ziploc bag. Yeah, we didn't show anybody those. Yum. All right. Hey, everybody. Welcome back to What's for Dinner. I hope you're all doing great tonight. Just remember, nothing you hear tonight should be considered medical advice. If you guys have any medical questions, make sure you reach out to your highly trained and knowledgeable healthcare provider. WorldLinkMedical.com, lowcarbusa.org, or smhp.org all have provider directories on there where you can look up some people who are, providers, whether they're health coaches or personal trainers or actual providers who are trained in metabolic health. And then also there's hormone specialists on there as well. So we're doing things a little bit different, guys. We're going to be not really talking about the things we're eating tonight. You'll notice some changes in the way we're formatting our videos and some other things that we're going to be doing. There'll be a little bit different. We're trying to play with things and try and manipulate YouTube and Facebook, the algorithms and whatnot. So if things are a little bit different, that's why. All right.
Well, go ahead.
I was just going to say, in tonight's theme, did you want to do it?
Bioidentical hormone replacement therapy, the ins and outs, part 1.
Okay.
So what happened last week is a guy on YouTube commented about his 44-year-old wife and was just asking a few questions. And I think he said, didn't he say the doctor said there's nothing you could do at 44?
Yeah, that's exactly what he said.
So I'm going to give you the little ins and outs. This is what I tell patients that come to see me for the first time. It just gives you a little explanation. And then we'll do a part 2. And if a part 3 is needed, we'll do a part 3. This is for women first. So men, listen up, because you have sisters, sister-in-laws, daughters, wives. All these people can benefit. So number 1, it is my humble opinion that a woman should be placed on progesterone or testosterone at the first sign of low progesterone and low testosterone. It doesn't matter the age. So I have a girl who I just gave progesterone through her entire pregnancy. She's in her 20s. And because that's what I do, because they won't do it in corporate medicine. If you've had history of miscarriages, progesterone is the hormone of gestation. So when she came back in to see me with her little baby, she brought in a little carrier. She said, it helps my moods so much. I asked my GYN if I can stay on progesterone for moods. And the GYN said, no, your baby was already delivered. You don't need progesterone now. So she's back. I'm giving her progesterone. But anyway, for sure, every woman over 40 needs hormones and all men over 50 need hormones. But this is a hormone for women talk. So estrogen and progesterone should be balanced. Progesterone goes first around age 35. So let me say menopause happens for most women between 45 and 55. It's a 10-year period. It's very wide. However, hormones can decline, and that is progesterone and testosterone 10 years before that. So around 35, women can start to notice a difference unless you've had severe endometriosis, menstrual migraines, or polycystic ovarian syndrome. You were born with a little naturally low progesterone. So then in your 30s, when it wanes, you really notice it. You become a really hot mess. But progesterone goes first. This imbalance of estrogen to progesterone causes weird, wacky periods, heavy bleeding. This is the age group women get hysterectomies or uterine ablations. What really we need to try first before we take the uterus out, because then your bladder will fall, is to bring progesterone back up and see if we can get away with not needing a hysterectomy. So progesterone is the hormone of contentment, helps with anxiety, depression, sleep, and an evenness of mood. I said that to a patient this morning who had had a total hysterectomy a long time ago. And she said, yay, that's what I need. And so I was just being smarmy. And I was like, corporate medicine says you don't get it because you don't have a uterus. But I didn't mention anything when I just mentioned progesterone and all the benefits. I didn't mention one thing about uterus. Progesterone also protects the breasts from breast cancer. It helps your heart and your bones. So this disparity of low progesterone and normal estrogen makes you estrogen dominant, relatively speaking. It's not a medical term. It's not a medical diagnosis, but when estrogen is in charge, she's the dominating hormone. So if you do nothing and go into menopause, estrogen falls. Then you get hot flashes, night sweats, dry vagina, painful sex. Later on, old lady diseases like osteoporosis, which we've had the pleasure of reversing in the office. And my friend who's a doctor in Orange County just put a case study up on his Facebook page of a woman's DEXA scan improving with hormones. So osteoporosis, heart disease, Alzheimer's, and dementia. Dementia and Alzheimer's, first of all, is type 3 diabetes. Your brain gets severely insulin resistance with the way we all eat. Second of all, we have a statin prescribing epidemic. Cholesterol lowering medications is known to cause dementia and type 2 diabetes. But also estrogen in a lot of the neuro journals, the neurology journals, there are good studies showing early onset dementia, get them with estrogen, men or women. Men naturally convert testosterone to estrogen, but men or women, early onset dementia, get them on estrogen and you can improve greatly. Okay, those are neurology journals. So we want estrogen and progesterone to be balanced. Okay, progesterone goes first, estrogen follows. Okay, so progesterone's a capsule you take at night because the side effect that she gives you is sleepiness, which when women start to go into perimenopause is real, but corporate medicine doesn't recognize perimenopause, just like they don't recognize estrogen dominance, low progesterone and normal estrogen. It's not like estrogen got higher. She's just the only one that's around now. So we take progesterone at night because she helps with sleepiness. And then we take estrogen in the morning. You could take it at night, but I just prescribe it in the morning. And then testosterone. Testosterone's a cream women use on their vaginal area daily. The men are faster metabolizers, so they have to use it on their scrotum twice a day. That's the absorptive area in your body. And testosterone for both sexes is sex and muscle. You cannot have a libido without testosterone. And females, if they ever have a libido, it wanes after about 25, 27. They kept you coming along in like, oh, what are those old magazines from the 90s and 80s? Glamour and Vanity Fair. They kept saying, oh, women are going to be having sex like crazy in their 40s, your libido. It's like, it doesn't. It just keeps going down. So, but besides sex and muscles, testosterone is zest, vitality, motivation, strength, stamina, get up and go, get your list done. All the hormones help with anxiety, depression, blood pressure, cholesterol, heart disease. Testosterone also protects your breast from breast cancer. Now, I just said cholesterol. I don't really care so much about cholesterol, but it can erroneously go up much higher if you have thyroid disease or when you enter menopause. Okay, but they want to give you a statin, not what you're missing, which is hormones. The medical community does not learn hormones. The end. Okay, put that in your notes. When you're talking to your physician or nurse practitioner, and you could be talking to a GYN. I had to see a GYN here in town at Mercy back in 2019, and he told me I was having an ovarian issue, and he said, you just need the birth control pill. And he said, but don't worry, I have a progesterone-only birth control. You don't. It's progestin. It's the mini pill. It's a completely different molecule. It's like saying, me watching you eat a banana and me saying, how's your banana? It looks so good. And you say, it's an apple. It's different, okay? But they don't know the difference. I promise you, when you think they're talking about hormones, they are talking about synthetic stuff, which we'll get into in part 2. But I was talking to a woman today who is 58. She's 54. She had a hysterectomy at 30 total. One ovary left. Sorry, not total. One ovary left. One ovary taken, uterus taken. Age 30. No one will give her hormones. I'm trying to help her because she doesn't live in a state I have a license in. But when I talked to her, she said, my primary said she would give me estrogen and progesterone. And I was like, very skeptical because I've heard it all. So I was like, do you know, like, was it real progesterone? Was it at the local pharmacy? Was it compounded? So while we're talking, she's getting on her hospital portal to find it. It's Prempro. She has a script waiting for her for Prempro. Prempro is pregnant horse pea Premarin, estrogen, and Provera, which has a black box warning for breast cancer. But she was told she's going to get estradiol because she kept saying to me, estradiol, estradiol. I use estrogen and estradiol interchangeably because I'm always talking about estradiol, and there's one more syllable in there, but I'm lazy. But she specifically asked, she was specifically told she was getting estradiol and progesterone. So this is stuff I get highly mad at, and it's just aggravating to me because when women start to go into perimenopause, which is 10 to 15 years before menopause, you're talking 30 to 35 years old, okay? Women know something's changing. They become irrational, overwhelmed, moody, like they just overreact. And I remember it. I do too. I got excited at the kids' kindergarten homework. And I promise you, when I say kindergarten, I promise you, they would send a packet home and you do over the month. And the thing I got excited about was connect the dots in color and the shape of whatever the dots made. Mark was behind the kids and he points to our room, get in the room, go from here, you're crazy. So I went in the room and I just start crying. And he comes in a little while later and he's like, what was that? And I'm just like, I don't know. I felt like I was crawling out of my skin, like I'm going crazy. And simultaneously, what else is happening is I have thyroid disease that was not managed correctly, which we'll do another video on that. And so I was always tired, napping. All I thought about was when my next nap was. And so simultaneously, acting cuckoo, I can't sleep. I have insomnia now. So when all of this starts to happen, you become cuckoo, plus you start to gain weight because now you have cortisol activated because you have low hormones. You're not sleeping. When you have low hormones and you're not sleeping, you start to crave carbs and weird food. I remember being in our pantry eating semi-sweet chocolate chips, which are nasty. They're good in chocolate chip cookies, but they're nasty by themselves. But that's what I was eating and hiding food and trying to eat. Anyway, I say progesterone takes away most of that craziness. And now I say, now it's a little bit better. But when the kids were like 13, 14, 15, I would say, I'm still crazy 10% of the time because I have teenagers. And when we moved to this house, I remember asking Nate a couple times to take the trash out. And every time he'd say, where's the trash can? That's annoying. Progesterone can't help that. Okay. So 10% I'm still crazy. 8% is because I live with people and you're not always, getting along like the kids. And then 2% is left. And that's just the crazy that God made me. And it's not going anywhere. But overall, my life is so much better and even. And I remember Mark saying way back when I got on hormones, he said, I always loved you, but this is much easier to love you now. Because we're messes. And it happens to the guys, which we'll do a video on specifically on the guys, but it's much more insidious. We just get knocked on our butt when progesterone leaves and testosterone leaves. You're annoyed, you don't have a sex drive, your husband still wants sex, and you're just like, I'm not having sex. And things just tumble into an abyss.
Yeah.
Which we talked about a couple of weeks ago about marriage and stuff. So the medical establishment does not recognize perimenopause, but women are suffering for 10 years before menopause, and then they still don't care. And I was telling this lady I was talking to today that got offered Prempro, I said, also what you guys need to know is in the standard of care, it is not standard of care to ever check a hormone level. So if you annoyed your doctor or GYN long enough and they gave you a little piddly dose of estradiol, because they do give estradiol most of the time now, which is the bioidentical form. They'll never again check a level. And it'll be enough to take care of hot flashes, night sweats, and most cases of vaginal dryness, but it will not build bone. You will still lose bone if your levels are not a certain level. So I like to see estrogen at a level of 60 to 80 minimum to build bone, and that's Quest, not LabCorp. And then progesterone, you need at least, some studies say 5 to offset estrogen, but I shoot for 10 and above. So, and my starting dose for estrogen is 1.5. Well, actually, it's nuanced and it's a gut feeling. It's depending on how long you've been in menopause. But if you've been in menopause, like this lady I talked to today, I would start her at 1.5. She doesn't have a uterus. She's not going to bleed. The side effect to adding estrogen is you can have a period again, depending on how long you've been in menopause or how short you've been in menopause. My starting dose for progesterone is 200 milligrams. I'm on 600 milligrams of progesterone, and I am on 2.75 milligrams of estradiol. How much time are we at?
Oh, it's fine. Just keep going.
So progesterone, Mark and I we were on hormones. Both of us were on hormones. We were on our way to Utah for a hormone conference, and he was driving because back then we used to like to drive. And I said, oh God, someone's going to die. And he was like, or I think I said the kids are, something. And he was like, what are you talking about? So I got to the hotel that night and I said, okay, I don't know what this is. So I took an extra progesterone. So I took 400 milligrams of progesterone. And I did that the whole conference until we got home. And then I went off. And then Mark came to me one time and he's like, so-and-so is going to visit us. So if you could take a little extra of something, because then you won't get as riled up and I won't get as riled up. And so I took extra progesterone until the visit was over. And then I went back. And then I realized, why am I going back to 200 when I feel great on 400? And so then I made my way to 600, and that's where I am now. Now, if you tell your GYN that I'm on 600, you might give her a heart attack. So maybe just leave that part out. And then estrogen. I missed that I was going into menopause, but I was having severe anxiety, but we were in an extremely hard season. But I've only had 2 panic attacks in my life. One was postpartum. I was 36 years old when I delivered twins, and I was contracting at 18 weeks, got put on bed rest. I needed progesterone. I didn't know that then. I took all their other things. So I delivered early, old. My mom died like 2 weeks after my boys were born, like suddenly, unexpected. So I'm like severely crashing in cortisol and everything else, and I'm old at 36. Progesterone wanes at 37, and I'm not making anymore. So Mark found me in a corner crying postpartum, and the only other time was when I figured out I was in menopause. But Mark came home from traveling one day recently, like 2021, and I said, I just sat down on the couch and I was like, I have such doom in my belly, someone's going to die. And again, it's like, what? And then a few weeks later, I had some night sweats, not sleeping. I gained weight, which is, I didn't change anything I was eating, but that's estrogen missing made me gain weight. And we went to Orlando to a conference, and I had a panic attack on the streets of Orlando. And Mark's like, we're leaving, we're going back home. Like, I just remember thinking my kids were with my mother-in-law in Clearwater, and we were in Orlando. And I was like, I want the kids here now, like just freaking out. So I went to bed that night and I was like, Lord, heal me or show me what it is. And I dreamt of a patient one of my very first patients that I put on hormones. And she came back to see me and she goes, I no longer need to carry bail money. Thank you very much. And I woke up and Mark was like scared. What's it going to be? He's like, what happened? How is it? And I was like, I need estrogen. Came home, checked my levels, started estrogen. Within 7 weeks, my night sweats went away. Within 6 weeks, my waist went back to normal. But I had some periodic anxiety thrown in there. So I would just increase by 1/4 milligram until I got to where I am now, 2.75. My last estrogen level was 81. That's perfect. Okay, see what I'm saying? So this is all nuance, but your providers don't recognize peri. Women are drowning in perimenopause. This is when your marriages are in trouble. This is when kids are growing up. Suddenly you're left with your spouse and you're just like, who are you and what are we doing? So you need to keep pressing somebody for hormones. And I would find someone that does bioidentical. Don't rely on your primary like this lady is doing. She's not anymore. But for PrimPro, it's bogus. We don't need that.
Worldlinkmedical.com, provider directory. That's the way to go.
But this lady's in Arkansas and there's no one in WorldLink. But I remember meeting someone from Fayetteville, Arkansas. But anyway, you can Google stuff too and you can find people. But do not suffer. Okay, getting older is a normal part of life, but to suffer is not. And for you to go to the provider and they give you oodles and oodles and oodles of antidepressants and then a sleeping pill and then an anti-anxiety, then you gain weight and they give you a weight loss drug when all you need is hormones. Why don't we give hormones as loosely as we do all of these other things that have side effects? When God made you, because you all know I love God, God made you with estrogen, progesterone, and testosterone receptors. He did not make you with Prozac and Lexapro and all of these other antidepressants.
For sure.
So,
okay.
I think that's pretty good for now.
Yeah, that was really good.
Okay.
So, hey guys, if you haven't already done so, please hit one of those buttons on the screen there. Like us, follow us, give us a thumbs up, throw us some hearts, whatever you guys can do to help us out. And also, it also helps out if you guys want to comment, ask us questions about what you'd like to have us talk about.
Yeah.
Tell us your stories about what you've had going on with hormones and, what good, bad, in between.
Right. Drop in the comments any interactions you've had with people.
Absolutely. Yeah. Fire away. So, as always, we love you guys
So much.
and we will see you all next time. I hope this was all helpful for you. All right. Bye.
Bye.